We've learned a lot about hormone replacement therapy over the last decade or so in terms of benefits and risk. And it's clear now that in terms of cardiovascular protection, that hormone replacement therapy is not protective, particularly when given remote from menopause, and increases the risk of events. But the area where it is indicated is in treatment of perimenopausal symptoms. And then they can be severe enough that even in a woman with a history of venous thrombosis, there is an indication for their use. In the United States, traditionally, there have been equine-derived oral estrogen replacement, and those do carry an increased risk of venous thrombosis. But transdermal preparations in a number of studies now have been shown to be safe, as have some locally applied estrogen therapy to the vagina for vaginal dryness symptoms. So there have been studies, particularly in France, looking at the safety of these preparations in women with a history of venous thrombosis. And while the numbers are still a little small, and some of the preparations are slightly different, there's a lot of increasing evidence to say that this is safe for these women and can be a very welcome addition to their treatment short term. The group that I would not recommend them in are the few women who have a very severe clinical thrombophilia where, say, they've had recurrent thrombosis on anticoagulation. In women with that kind of history, I think any estrogen carries a risk, so I don't recommend it for those women. But for many women, I think we have to rethink our approach in this area.